All right. Thank you so much for introducing us and inviting us and letting us speak and to tell everyone a little bit about our PM&R residency program at Spaulding. So my name is Katie. I'm actually the program manager over at Spaulding Rehab. We have our associate program director here as well. We have our director of medical student education, and then we have our chief residents here. And I thought that we could just start off by kind of going around and just introducing ourselves and saying what we like about Spaulding Harvard and the residency program that we have here. So I'll start. As I said, my name's Katie. I'm the program manager and I oversee the residency, and I also oversee all of our fellowship programs that we have here. Quickly, we have a sports medicine fellowship, a spinal cord injury fellowship, a PD rehab fellowship, and then a brain injury fellowship. And I've actually been at Spaulding for 3.5 years. So one thing I want to say that I personally love about Spaulding Harvard is definitely the people. I think that as far as the administration, the faculty, all the residents, the fellows, the medical students, really anyone that you come across here, you can definitely learn something from. I think everyone is very supportive, everyone has your back. And I think it's an overall just a great organization to be a part of. So I will go ahead and introduce our Associate Program Director, Dr. Babu.
Hey everybody, thanks so much for the invitation. Thanks for the intro, Katie. So I'm Ashwin Babu. I'm the Associate Program Director here at Spaulding. My background here is I'm in sports medicine, so I finished a sports medicine fellowship here at Spaulding actually, then get hired on directly, and I now work clinically at Mass General and administratively all throughout Spaulding. I've been working with the residency now for about 4 years and love every second of it. I think the thing I want to leave everyone with the impression of is I think Spaulding is a unique place where the family kind of atmosphere really comes through, and a lot of people say that, but I think I very much feel it every way. Every time we show up to work, there's a lot of people that you're working with who are extremely bright, are extremely knowledgeable, very driven, and it's a place where a lot is expected of you, but it's a place where you're supported a lot too. And so that kind of combination really allows people to achieve the greatest of what they can do. And I just love being a part of it. I love working with the residents and Katie and the rest of the administration. From the top down, we feel very supported, and it's a great place to train. And so with that, I'll turn it over. Katie, I think you'll kind of keep moving here.
Yep. So we'll have Dr. Tolchin go next. Dr. Tolchin is our director of our medical student education here at Spaulding.
Hi, everyone. Thank you so much, Katie. And thank you to everyone again for having us. So my experience at Spaulding actually started many, many years ago when I had a family member at Spaulding, but subsequently I've been at Spaulding for a long time, from medical school through residency, and now on as a faculty member. My particular clinical area is in neuromuscular disease and palliative care. And what I work on a lot now, in addition, is medical education and education for our students and our residents about care specifically for people with disabilities. I would be delighted to talk and connect with any of you after this to talk more about opportunities for medical students and being able to interact with folks in our program, given that we are unable to have clerkship students in person at this time. In terms of something I really love about Spaulding, Katie and Ashwin sort of covered it in terms of the collegiality and family atmosphere. Again, having been around Spaulding for over 20 years now, I found that to be consistently true and one of my favorite parts of being a part of our department. I will also share that I have really enjoyed and embraced the connections we have with other hospitals within our system, particularly with my focus in neuromuscular disease. Have really enjoyed our very strong relationship with the neurology departments in our acute care hospitals, along with other departments. So that's a particular strength of ours, and we share a lot of mutual respect with and work with our colleagues.
Thank you, Dr. Tolchin. Next, I would like to introduce one of our chief residents, Dr. Carolyn Black.
Hi guys, so I'm one of the Pgy4s at Spaulding. I grew up in Ohio, and then I went to undergrad in Baltimore, and then went to UC Davis for medical school. And my favorite thing about Spaulding is honestly the other residents. I feel like our program leadership does a really nice job of trying to select for people who have a lot of different and diverse interests. And I think like the best advice that I could give a medical student as you're trying to go through your rank list and think about what would be a good fit for you would be to kind of think about like the people who you want to be surrounded by. And I think the people at Spaulding, because there's all of these different interests, like we're constantly teaching each other. It's not like a competitive environment, but it's just other residents who are really going to like uplift you. And we all kind of help each other mature and become the physiatrists that we want to be. So I found that here. I hope that all of you will find that wherever you eventually match.
Thank you, Carolyn. And then lastly, we have one of our Pgy3 residents and also a chief resident, Stephanie Deluca.
Hi, everyone. I'm Steph. I'm from New York. I did pretty much everything in New York. I did my intern year, though, in Connecticut, and then came here for residency. Not to repeat what everyone said, but truthfully, my favorite thing about Spaulding is really the people and the collaboration you get. And it's collaboration at every level. I mean, you get it with the faculty, with your fellow residents, with administration, and the other residency programs, which I think is really something special about our program here. If you're having a question about a case, it's without hesitation that you just call up another residency program at Mass General or Brigham. And I think that's really something unique about our program.
All right, thank you, everyone. So next, I guess we just kind of wanted to open it up for a Q&A. If anyone has any specific questions for us about our program, anything as far as, you know, our rotation schedule, the call schedule. So if, you know, anyone has anything they want to ask us, please feel free. Give it a second. And please, by all means, feel free to put it in the chat, unmute yourself. Okay, here we go. How does Spaulding support resident research interests? What is the research time provided? Does the department support conferences? Does the program support research endeavors outside of the department? Do any of you want to
get started maybe, and then we'll doing. So the short answer is to a very high and aggressive degree. So Ross, our chairman, is all about getting residents involved in research in every possible way we can. And so we're in a privileged position where we often get many residents who come in with a ton of experience. So Carolyn, in classic Carolyn fashion, very skipped over the part where she got her PhD at UC Davis as well. So people, it's just classic. People come in with a tremendous amount of research experience like her, and others with not as much. And kind of wherever you are, we kind of make efforts to make sure that we can get you what you need. So the most basic way we go through this is with a mentorship program that's dedicated toward research. So you'll have a research mentor. And if your interest is in sports medicine, you'll probably end up somewhere towards me or some of the other colleagues in the sports division. If it's brain injury, we have people who do research in that range as well. And no matter what it is, we'll kind of find you to the right people. Then in terms of time, we actually put some specific efforts towards decreasing call and some of the weekends and all the other times to make sure that residents have enough time to dedicate towards research and reading academic interests. And then the last thing is often financial aspects are a barrier. Residents are supported going to conferences for research, and I'll let Carolyn and Stephanie talk to some of the details of that. But the main other thing, which is kind of unique, which we love doing, is we dedicate some money aside that's specifically there for resident research. It's a, you know, like an internal grant that people like me are on the grant committee, so it's not terribly difficult. The point of it is we want to make sure that we use it as a teaching tool, and so that you're ready to get not just not just grants from our program, but extramural grants as well. And so the short answer is this is a place where research is very highly valued. You can't really exist in the Harvard ecosystem without being involved in research in some way, shape, or form, and we make sure that people are well supported to do so. So I'll Stephanie and Carolyn, if you guys want to add anything else to that, please do.
Yeah, I would. I'm sorry, Carolyn, you can go ahead.
Oh, no, that's, so I just wanted to add that we also have a journal club for like more formal teaching. We also have like a formal research curriculum as part of our didactics, which we have every Tuesday morning. That's part of like our protected educational time. The research, like the stipend to go to conferences is pretty generous. So a lot of people end up going to both PM&R and AAP during the year. And then, I mean, you're just surrounded by research and people doing research. So that's kind of like in the air here.
Did you want to add anything, Steph?
Yeah, one more thing about then the research and your interests, even if you have a particular interest that, let's say, is not super common in the field of PM&R, generally because of our networking, there's someone that you can find, and maybe you're not aware of them, but the faculty here and your senior residents know a ton of people. So like for instance, I'm interested in pediatric sports medicine. It's not like super unknown, but it's definitely not as common as some of our other interests that we go into. There was no issue with getting research. Just basically, I just had to let someone know this is what I'm interested in doing. And then there are countless of opportunities available.
All right, thank you, Steph. Looks like we have another question. Is it possible to diversify your interests in your training, collaborate with other departments to pursue your academic dreams?
Yes, very much so. Between Mass General, Brigham, the folks at MIT, if there's somebody that you want to work with, we'll make it happen. We've had residents do rotations out of the country to get things what they wanted. So yes, the short answer is the curriculum is very deliberately designed. You're going to get a lot of the bread and butter things. You're going to rotate through like a dedicated brain injury unit, a dedicated spinal cord unit. You're going to have sports rotations early and late, and it's all kind of mixed together so that you kind of get a taste of everything. And by the time you get to your end of your Pgy3 year, early Pgy4 year, most people have kind of at least narrowed down to what they're interested in. And then that's when the elective time starts to hit and people kind of do whatever they want. So a great example was just this past year, one of our other chief residents, or former chief residents, wasn't sure if she wanted to do cancer rehab or sports. And so she spent some time working with me, and for the cancer, she worked with some of the other folks in our department and then went to Memorial Sloan Kettering and at least was planning to until COVID hit, unfortunately. But the point is that was set up and ready for her. Other residents have done the same thing. That was a path that was already well trodden. So that wasn't even in our ecosystem. She'd already worked with two of the folks at Dana-Farber at our local cancer hospital. And so we kind of very deliberately make sure that all these things are available to you. And kind of like was alluded to with the research interests, we just need to know what your interests are. Once we figure out what they are, there's tons of people. Women's health was another thing, which we already found. Someone brought it up a year or two ago, and we already found a whole group of people that are now set in like a formalized elective. So plenty of opportunities for that.
All right. How many hospitals are residents rotating through during Pgy2 to Pgy4 year?
I can take that one. So as a Pgy2, you're pretty much, in terms of inpatient, you're pretty much at Spaulding, except for 2 months you're at Mass General on the neurology service. So you're pretty much acting like a neurologist for 2 months, and that's back to back the 2 months, so which is nice continuity. And then you do 1 month at the VA in your Pgy2 year. In your Pgy3 year, in terms of inpatient, you're only at Spaulding, but it's more, we basically get heavy outpatient as the years go on. And then in your Pgy4 year, you are pretty much mostly outpatient, but for your inpatient rotations, it's at Spaulding in Charlestown, as well as our LTAC. And those are your rotations for inpatient.
All right. Let's see here. How are didactics run? Is it protected time?
It is strongly protected time. Kevin, our program director, signs into the call pager. So you're not being interrupted by pages during that time. Attendings are covering the services during that time. So it is truly protected. And it's usually like 7 to 8 a.m. till about like 1 p.m. Every Tuesday morning. We get fantastic lectures from Spaulding attendings, from Mass General, from Brigham. We really have access to a lot of like top-notch people who come and teach.
All right. Can you elaborate in more detail the leadership catalyst Can you elaborate more detail the Leadership Catalyst Research Fellowship? For example, from my understanding, it is an additional 2 years. Is it, in what ways are you measuring its fellows' success?
So this, we may, if I'm understanding this question correctly, this may be better taken, unfortunately, the people here aren't involved with that, the research fellowship specifically. Is more for the residency and the fellowship programs through the match. The point, the take home of this program is that, yes, there exists additional research opportunities that will be supported. We have in the sports medicine world and in others, research specific fellowships that you have protected times. You're kind of brought on as like half faculty to have protected research time, have a small clinical involvement. And the goal and the success of that is to kind of kickstart somebody into a research career. And so we think of it kind of like a pre-K award. The point is to like set you up so you're ready for a K award, which is then set you up for an R1, et cetera, et cetera. And so, obviously first order publications, kind of independent research thought, and independent, gradual independence from a research standpoint are the main goals of those programs.
You guys have just under 5 minutes.
Thank you. What is the call schedule like during Pgy2, Pgy3, and Pgwa, and is there call for Pgy4s?
I'll take that one. Basically, in a nutshell, the call is heavier in your Pgy2 year, a little bit less Pgy3 year, and then Pgy4s do not take any overnight calls. So that's a big perk. We do all take calls on the weekends, but the nice thing is that we have protected times on Saturday night and Sunday night where we have someone from other residency programs. After noon, they'll come in and do the overnight shifts. So it gives us flexibility to work on other projects that we have and just, to have a life outside of the hospital. And I should say the call at Spaulding is in-house. When you are at Mass General, you take call with the neurology schedule. So that's at Mass General and you're not included in the Spaulding pool.
If we got a couple minutes left, maybe just a last word to recap. Great place, great people. You'll learn a lot. You'll work hard, but it'll be worth it. Thank you.
Thanks, Ashwin. Something I just wanted to briefly mention are the elective time that we have. So we have 2 months of electives for your Pgy3 year, 2 months of electives for your Pgy4 year. And something that I think is, cool and interesting about our program is you basically can do whatever you want. Of course, we require you to write out an elective proposal, your goals, your objectives, what you're going to be doing, but ultimately you're able to do anything, in the country and even the world. We've had residents travel to different countries, or residents travel, if they want to spend a month closer to their family, then, they're certainly welcome to do an elective at a hospital, across the country near where they grew up. So I think that's something that our program offers that is very good for people, and we support what you want to do, and yeah, I think that's a cool aspect of the residency, in my opinion. Are there any other last questions that we can answer in the minute or two we have left? I'm going to go ahead and put my email in the chat as well in case people have, questions that come up later. Again, I'm the program manager, so all the questions usually filter through me. And if I don't know the answer, then I will usually forward them on to the chief residents or, anyone else. So I'll go ahead and do that now. Feel free to email me. No question is silly.
I'm seeing in the chat real quick in the last couple of seconds. Yes, we have a formal mentorship program. You'll be assigned a mentor when you walk in the door, and then that will kind of split into specific mentors depending on what your interests are. And we do this pretty much every year.
You guys still have time for probably another question, maybe 2.
Is there anything that Dorothy, staff, oh, here we go. How is the daily commute?
It depends a lot on where you decide to live. So our residents are all over the Boston area, and we do travel to different hospitals. And so like I live down the street from Spaulding, which is very convenient for me. We have somebody commuting from New Hampshire, which I think is like the longest commute. It is a real city, so you will get some traffic. but there's also like really good public transportation for most of the rotations, and people usually figure it out. And usually the farther away rotations are the ones where it's really worth it to go. So I think our farthest rotation is down in Foxborough, but that's like at Patriots Place, where you're working with like amazing sports attendings, and you get to see like amazing athletes down there. So there's some traveling, but it's pretty worth it.
Yeah, the rationale behind where the rotations are set up is we want to make sure people are working with the best folks we can find, no matter kind of where they are. And it takes us a little further afield, and we have to balance it to make sure some of these things aren't too unreasonable. The commute down to Foxborough in the mornings, if you live in Charlestown, can be long, truthfully. That's definitely the worst of them. I think the rest of it isn't terrible. My clinic in Waltham is okay at most times of the day. But the point of it really is the network spans so much space that if we can find a good option for you, we will. And this is also important because a lot of residents, particularly in their later years, will do more, will choose more of their electives, and they'll really look further afield at the neighboring hospitals in the network as well. And that can sometimes get a little longer too, but certainly worth it.
Well, guys, thank you so much for your time, for joining us. That was fantastic.